In this clip, we're going to introduce you to KEDLEY Kinesiology tape. Kinesiology tape's been around for a long time. Initially, it was thought that the tape's therapeutic benefits were because it was made from silk. We now know that the tape's benefits really are because of the tape's elasticity or stretch and the wave-like pattern of adhesive application. If you look at the tape, you can see it's very flexible. You can see there it has a wave-like pattern of adhesive application. Together with the flexibility, once the tape stretched and recoils, and the wave-like pattern of adhesive creates a ripple effect that lifts the epidermis from the dermis and facilitates drainage. That's the main benefit of this tape. The tape can also enhance proprioceptive input. It helps with position sense, and when applied with a little bit extra stretch, will provide moderate support to injured muscles and joints. Let's discuss how we can prepare the area before we apply KEDLEY Kinesiology tape to it. It's very important that the area is clean, it's dry, it's free from oils or creams that will prevent the tape from adhering to the area. It's preferable to have the area free of hair or certainly excessive hair to allow the tape to adhere to the skin and to enhance the proprioceptive effect of the tape. It's very important when we look at the skin, if there's any signs of irritation, if there's rashes or any lesions, please do not apply the tape. Whenever you have any doubts as to whether the tape should be utilized in the area, please get advice from a healthcare professional before you apply the tape. Let's have a look to see how we can utilize KEDLEY's Kinesiology tape to provide support for the cervical spine. First of all, what we're going to do is measure the tape. We take from the mastoid process just behind the ear to the spine of the scapula, the bump you can feel, and we measure the tape. If we cut the tape, we round the edges of the tape. The reason we round the edges is to provide extra support, prevent it flapping, to help the tape adhere to the skin more effectively. Once you've got the tape, with it cut and rounded to size, we peel the tape. We feel for the spine of the scapula. We place the tape on the skin, add a little support, place a finger to support the anchor, bend your head forward, place the muscle in a slight stretch, stretch the tape as far as you can, retract about 50%, gently wipe the tape on, give it a light rub, bring your head back to neutral position, and you have the tape adhered. Very important when you apply the tape that there's no tension on either of the anchors, so we provide comfort and prevent any irritation of the skin. We then repeat the same procedure on the opposite side to provide symmetrical support. Feel for the spine of the scapula, support the tape, bend your head gently forward, put the muscle in a stretch, stretch the tape as far as you can, retract it about 50%, gently wipe the tape on, come back to neutral, wipe a few times just to activate the glue, and the tape is there to provide gentle support to the paraspinal muscles. Let's have a look to see how we can use KEDLEY's Kinesiology tape to provide lumbar support. First of all, we measure from the trochanter. You can feel the bone from the top of your thigh to your rib. Place a strip of tape. We measure from that point to that to give us the length of tape we need to cut. We've got this tape pre-cut. We've rounded the edges, as always, to allow the tape to adhere and be more comfortable. Peel the tape. Okay, expose the area. Get some support on your anchor. Get your patient to bend forward gently and turn to the opposite side. Place the muscle in a stretch. Stretch the tape as far as you can. Retract 50%. Gently wipe the tape on. Okay, and make sure that there's no tension on either sides of the anchors to prevent any irritation of the skin. We then do the same on the opposite side. Peel the tape. Expose the area to get the skin contact. Get your patient to bend forward and turn to place the muscle in a stretch. Stretch 50%, retract slightly, and wipe on. Patient back to neutral. And we're going to repeat that now, just slightly higher to create a lattice effect and provide general support for the lumbar area. Slightly higher, Get the patient to flex once again, and rotate, stretch, release, wipe the tape on, and make sure there's no tension on the anchors. Repeat on the opposite side to balance it out. Apply the tape, patient to bend forward, rotate, opposite direction, rotate, stretch, release, and gently wipe the tape on. Once the tape is on, make sure there's no creases or folds that would create irritation. Gently rub the tape very lightly to activate the glue, and you've got lumbar support. Let's have a look to say we can use KEDLEY's Kinesiology tape to provide support for shoulder injuries. First of all, we'll measure the tape. We feel the deltoid cleft. We move around to the top of the AC joint to get our length of tape we need to cut. We've got our tape that we've pre-cut. As always, rounded edges to help with adhesion and to provide extra comfort. We peel our tape. We feel for the base of the deltoid, the medial deltoid. Okay, get the patient to place it in the stretch, put the arm across in the front. We stretch the tape, providing support so we have no pressure on the anchor. Stretch, release, unfold so we go over the top of the AC joint. Gently apply the anchor. Relax, and we will repeat on the opposite side to the anterior component of the strap. Peel the tape. Apply the anchor, stretch the muscle, stretch as far as we can, release, and then slowly fold the tape onto the skin. To release, rub the tape, give it a light rub to activate the glue to ensure it sticks properly. Let's have a look to see how we can apply KEDLEY Kinesiology tape to provide support for a patella tracking issue. First of all, we do is we measure the tape. We go from the tibial tuberosity, the bump in the shin, to the midline of your quadricep to get the right length of tape. We've got the tape pre-cut. We've rounded the edges, as always, for comfort and to ensure that the tape adheres more comfortably. We peel the tape. We feel for the tibial tuberosity. Just below that, apply the tape, put pressure with your thumb, with your finger to support the anchor, stretch the tape, release it by about 50%, and fold the tape onto the skin. Make sure at the top, you can see we fold it down, there's no tension on the anchor to prevent irritation of the skin. Give it a light rub to support it, and repeat on the other side to balance it out. Okay. Provide support at the anchor, stretch as far as you can, release about 50%, and fold the tape onto the area. You can see when we're doing this, we're doing it with the knee in a flex position so that the muscle is placed on a stretch when we apply the tape. That allows the patella to be supported and helps control patella tracking issues.